The drug that we have chosen to do is oxycodone. Oxycodone is an opioid analgesic and is a Schedule 8 drug. Here is a 3D model of the molecule of oxycodone.
Oxycodone can be taken via many routes of administration. When taken orally, it must cross many semi-permeable membranes. However, when taken intravenously, it bypasses this process and enters directly into systemic circulation with a bioavailability of 100%. However, if it is taken orally, it must first be absorbed before it is distributed throughout the body. When oral oxycodone is swallowed, it makes its way down the gastrointestinal tract, where the stomach acid will disintegrate it into much smaller particles. Once disintegrated, the oxycodone particles will enter the small intestine, where they will be absorbed into the bloodstream, as oxycodone is a weakly basic drug and will become unionized and lipophilic in a basic environment such as the small intestine. Once absorbed into the blood, oxycodone is between 38 to 45% protein bound and will bind mainly to albumin, eliminating the protein-bound drug molecules. The unbound drug molecules will travel to the liver to be metabolized and subject to first-pass effects. The bioavailability of oral oxycodone can range from 60 to 87%. Oxycodone is extensively metabolized in the liver via the CYP3A45 enzyme, which will metabolize 45% of it into noroxycodone, and also via the CYP2DS enzyme, which will metabolize 19% of it into oxymorphone. Noroxycodone's affinity for opioid receptors is 1/3 and potency 5 to 10-fold less than oxycodone. However, oxymorphone has a 10 to 45-fold higher affinity for opioid receptors and is 8 to 30-fold more potent compared with oxycodone. These metabolized forms of oxycodone will now enter the bloodstream and be distributed to opioid receptors around the body. Both metabolites undergo glucuronidation, making them hypophilic and are excreted with unchanged drug in the urine.
Oxycodone exerts its analgesic activity by binding to the mu receptors in the central nervous system, therefore mimicking the effects of endogenous opioids. Binding of the opiate receptor stimulates the exchange of guanosine triphosphate for guanosine diphosphate on the G protein complex and inhibits adenylate cyclase, thereby preventing cyclic adenosine monophosphate production, which involves intracellular signal induction that assists in the regulation of glycogen, sugar, and lipid metabolism. Additionally, the release of nociceptors neurotransmitters inhibits the release of vasopressin, somatostatin, insulin, and glucagon. Oxycodone also closes N-type voltage-gated calcium channels and opens G-protein coupled channels inwardly, thus rectifying potassium channels, resulting in hyperpolarization and reduction of neuronal excitability. The full mechanism of action with oxycodone is not known. Under conditions of inflammation or high sensitivity to pain, opioid receptors in the heart, lungs, liver, gastrointestinal tract, and reproductive system increase in response to a stimulus, and those receptors are transported to nerve terminals. Oxycodone has 3 active metabolites: noroxycodone, oxymorphone, and noroxymorphone. They are all opioid agonists, and these compounds passively diffuse across the blood-brain barrier or can be actively transported across by an unknown mechanism. Oxycodone and its active metabolites can selectively bind to the mu receptors. It can also bind to kappa and delta opioid receptors in the central nervous system and periphery and induce a G protein coupled receptor signaling pathway. However, activation of mu opioid receptors inhibits N-type voltage-operated calcium channels, which in turn inhibits responses to pain.
Efficacy is the degree at which a drug achieves more benefit than harm in an ideal environment. Simply put, efficacy is when benefits are greater than harm. As shown in graph 1, efficacy can be different between 2 different drugs that achieve the same goal. Different drugs have different potencies whilst resulting in the same effect. For example, Mi-Kyung et al. 2018 conducted a study of post-operative hip surgery patients that found a single bolus injection of oxycodone was more effective at reducing pain than a bolus of fentanyl. Both drugs can achieve the same efficacy or effect, but oxycodone is less potent as a smaller dose is needed to accomplish an equal therapeutic effect. Graph 2 demonstrates this, where drug A would be oxycodone and drug B would be fentanyl. Further, efficacy refers to the effect of a drug, most commonly the maximal therapeutic effect that a drug can produce. The more effect, the more efficacious the drug. Drug efficacy is important to drug safety as it demonstrates a maximum therapeutic range for a drug, from where it has positive effects up to the maximal point of effectiveness. After this Emax, the drug will again start to become more harmful than good as it poisons the body. Oxycodone has an affinity for delta kappa and mu opiate receptors. Oxycodone is a full agonist as it agonizes all three sites. Opioids are often not specific and produce multiple positive and negative responses. The positive effects are reducing moderate to severe pain and chronic severe pain. Some common adverse effects are nausea, vomiting, constipation, and dizziness. Oxycodone acts directly on some tissues unrelated to analgesic effect. These are respiratory system in the brain, which causes respiratory depression, cough center in the medulla, which suppresses the cough reflex, pupil muscles, which causes the pupils to decrease in size, consequently causing the patient to become myopic, gastrointestinal tract, which slows peristalsis and increases muscle tone, causing constipation, cardiovascular system, where histamine can be released, causing pruritus, red eyes, flushing, swelling, and decreased blood pressure, and the endocrine system, which may increase prolactin production and decrease cortisol and testosterone production.
Oxycodone is a significantly strong opioid drug that is a member of the Schedule 8 classification. It is defined as a controlled drug that is available for use but has manufactured restrictions in place, as it has the potential for high levels of addiction and misuse. There are many health professionals that are able to prescribe medication to their patients, such as doctors, both general practitioners and specialists, nursing practitioners, midwives, dentists, endorsed podiatrists, and optometrists, along with veterinarian surgeons. However, it is more common for doctors to prescribe oxycodone for their patients to relieve moderate to severe pain. When prescribing oxycodone, doctors are obligated to follow their state and territory guidelines and receive approval from appropriate health authorities when prescribing the Schedule 8 drug. There are several key members of an interdisciplinary team who are able to work in a coordinated fashion to ensure the quality use of oxycodone when it is being prescribed, such as medical practitioners, pharmacists, and nurses. Medical practitioners are to gain correct approval from authorities when prescribing oxycodone, along with them playing a significant role in counselling for the medication and educating their patients in regard to their pain management. Pharmacists also play a key role in the interdisciplinary team as they dispense the actual medication. They are able to counsel for the oxycodone and explain the purpose of the medication, its intended target, the adverse effects and reactions, along with the recommended dosage. Along with nurses who play an important role in the interdisciplinary team as they are able to also counsel and educate their patient. Nurses are able to monitor and observe patients in their care to determine and detect if adverse reactions are occurring or if the drug is taking sufficient effect. All members of the interdisciplinary team work together in a coordinated fashion to reach an overall goal to ensure adequate care and that the quality use of medication being prescribed is met to increase patient outcomes.
Allergic reactions. Patients should be advised to cease taking oxycodone if they experience any of the following symptoms, as they may be experiencing an allergic reaction to the oxycodone they have taken. Shortness of breath, including any difficulty breathing or wheezing. Swelling, usually on the face, lips or tongue, but can also be swelling to any other body part. Rash, this includes any areas of itching or hives. Precautions. When a patient is taking oxycodone, they should avoid the following activities as it can impair reaction time and judgment. Do not drive. This includes motor vehicles, motorbikes, heavy plant machinery and farming equipment. Avoid hazardous jobs. Avoid activities involving power tools or other jobs where there is an element of risk involved. Avoid alcohol, as alcohol can cause increased breathing difficulties, increased clumsiness and confusion when consumed with oxycodone. Only take as directed. Taking more oxycodone than prescribed can lead to an overdose. Overdose. If a patient has taken too much oxycodone and an overdose is suspected, an ambulance should be called immediately. Overdose symptoms can include, but are not limited to, the following: chest pain or any chest discomfort, including slow or irregular heartbeat, low blood pressure, small or pinpoint pupils, decreased responsiveness and awareness or increased confusion, extreme drowsiness and loss of consciousness.